A lecturer in physiology and the director aging research and ambulatory care, University of Colombo, Sri Lanka, and she is the president-elect of the Sri Lankan Association of Geriatric Medicine year 2026. Over to you, Dr. Chandra Gattadadu.
Thank you, Aisha, for that kind words of introduction. At the outset, may I thank the Sri Lanka Association of Geriatric Medicine for nominating me as a speaker in this prestigious conference, and Sri Lanka Medical Association for inviting me. Stepping in after two eminent speakers, I would like to just focus on the system reforms for an aging nation, integrating geriatrics into mainstream healthcare. So, the outline of my little discussion would be on highlighting the challenges of an aging nation, and my task has been made easier by the previous two speakers, and I would like to talk a bit about system reform, some of it, and the evidence behind it, and the challenges and way forward. So, as everybody is well aware that the Sri Lanka has the fastest growing geriatric population in South Asia, and we may be ill prepared, and the fact is the old age dependency is rising, and these are projections made by depending on the available statistics. We don't have the census data, the current census data yet. It will be published this year. So our life expectancy is increasing, and we are topping the South Asian region, and worldwide Japan has the highest aging population. So all of these has a lot of health impacts highlighted by Sir. Our health challenges are numerous, and what are our strengths in facing these challenges? Of course, our very robust healthcare system. As all of you know, and for the sake of Professor Sharul, I will just mention that we have a wonderful healthcare system which is free of charge, and without any discrimination we offer it to all the individuals. And it is both for the preventive and curative sector, and this is our little island flooded with hospitals, and we have a nice network of healthcare system run by the Ministry of Health. So we have a lot of resources, but we have challenges. As an aging nation, as Sir highlighted, there are many health challenges for an older person, like multimorbidity, cognitive impairment, disability, and reduction in functional ability. These are some of the things, and we have already discussed. And also I would like to highlight the prolonged recovery time for after an acute illness, because all of these cost a lot of money, although it's free of charge, and it put a lot of strain on our healthcare system. And these problems, like Prof. Sharul highlighted, has to be managed in that socio-economic background. So after the economic crisis, we are facing a lot of difficulties, as well as there's recent trend of migration of skilled workers, as well as change in family dynamics when all the children are migrating, ending up with social isolation, and of course with this rising cost of living and financial insecurities. All of these adds to the problems of healthcare challenges. So we have a lot of challenges. Yes, we have a lot of services as well, and to highlight the free healthcare, all the social services provided, and there are services provision through non-governmental organizations as well, but there's a gap, there's disparity, and of course it's tipping more to the challenges. So we need system reforms, and for an aging nation like us, I would like to highlight a few of the system reforms that we have been, as a nation, we have been focusing on, like the workforce strengthening, empowerment of older adults, and improving age-friendly healthcare facilities. These are some of the reforms. So healthcare workforce, I would say, is our biggest strength. We have doctors, nurses, allied health professionals. They are trained well and they receive their postgraduate education. We have a wonderful workforce, and that is our biggest strength. We may not have a lot of money, we may not have the technology in all the hospitals, but we have our healthcare force. So, strengthening the healthcare workforce but through capacity building, I would like to appreciate all the effort done by the Minister of Health and all the professional colleges like Sri Lanka Medical Association, Sri Lankan Association of Geriatric Medicine, College of Physicians. Everybody put in a lot of effort to train our existing healthcare workers in the geriatric medicine, as well as all the universities and most of the medical faculties have incorporated geriatric medicine in the curricula. So this system reform is a very positive trend. And also the postgraduate institution of University of Colombo, they have trained geriatricians, and now we are privileged to have about 4 geriatricians serving our country. So I think these are all efforts of past 10-15 years coming to this now, as well as the postgraduate diplomas running, and all of it contributing to capacity building. And also our association, as well as a lot of professional organizations, have taken up in training the allied health professionals, because as Sir highlighted, multidisciplinary care is the cornerstone of geriatric medicine, and we cannot do it alone. We need to improve the skills of other professional healthcare professionals as well. And also it's incorporated into their curricula as well, undergraduate curricula, which is a very positive trend. So education as a key system reform, I would like to highlight all the effort done by all the professional colleges, as well as some eminent speakers who are seated here as well, whose effort has brought our system reform into reality. And the next step is the integration of geriatric medicine into the existing healthcare system. We have the primary care, tertiary care and community care service, and also the Ministry of Health and other organizations are highlighting the healthy aging or promoting healthy aging, as well as the newer concepts of intermediate care incorporating into the current healthcare system is underway, as well as, although it's not formalized, our long-term care institutions, retirement homes, which are, some are privately funded, some are free of charge, maybe not integrated so much, but the process is in place and we need to work more towards that. And also our strong community care. But the integration part is somewhat lacking because we don't communicate so well, and doctors are notorious for not communicating for what we are doing to the patients or the caregivers and to the next level. But we have everything fragmented, which needs to be linked properly. And the integration is the next system reform that I would like to highlight, which is in place. And we have to highlight the value of our client, because the patient should be in the forefront of all of this, and empowering older adults and improving their health literacy is a must. And we are doing a huge service in that regard through the professional colleges again, and through Ministry of Health and all the media institutions supporting this endeavor, because we need to empower them with the adequate knowledge to care for their illnesses. So highlighting on the next system reform would be improving the geriatric healthcare services. We won't be able to build new buildings or hospitals, but existing services we are strengthening. So primary care strengthening program is at the forefront of the Ministry of Health through the ICO, and intermediate care facilities are being formulated, as well as geriatric units are coming up in major teaching hospitals, and the latest being in Anuradhapura, which is shown in the below down picture. And also our public health nursing officers. We have few, we are training them, but they are doing a huge service in the community, visiting houses with older people. And I talked about retirement homes, and also I would like to highlight that to improve our healthcare services towards geriatric care, we need to partnership with private organizations as well. So that could be one model that can resolve some of the financial constraints that we have. And furthermore, partnering with other organizations, with regional organizations and international organizations, some of these systems and some of these work is already being done. And the social support structure which is there in our country, a lot of free services are available. Sometimes we may be also unaware of them, but the National Secretariat for Elders, the Social Services Department, National Council for Elders, all doing a wonderful service, and some of the NGOs like HelpAge and the international organizations which are helping us to navigate these challenges. WHO, UN, UNFPA, and the Asian Development Bank. Especially they are funding the research which is carried out and the data gathering, and currently we are happy to say the Center of Aging Research and Ambulatory Care at the University of Colombo is partnering with the Aging Research Center in the University of Colombo and WHO in carrying out the World Health Survey, plus in Sri Lanka, aim to gather existing data on what is happening at the ground level. Because data handling is one of the system reform that I would like to again highlight, which has meaning, because we have to know what's going on in order to improve and to the plan the next years. The policy reforms currently, the Ministry of Health is revisiting and developing the health master plan for the next policy cycle starting next year, and the UN Decade of Healthy Aging and the action plan is in place. But as Prof. Shahril said, there are gaps in implementation, but all of these policies have guided the work so far, what we are doing at the moment. And the National Elderly Health Policy was launched in 2017 by the Ministry of Health, and some of the things highlighted in that policy is underway. And there are other things which are interrelated to healthcare in Sri Lanka through the National Charter for Senior Citizens and National Policy for Senior Citizens, and the legislation processes in order to prevent elder abuse, ensuring the rights of older adults. That was amended in 2011 as well. So these are all very good trends going into the future in an aging nation like us. And I would like to highlight some of the policy dialogues which have been happening, because involving all the stakeholders are important, not only the healthcare providers, healthcare workforces, but other social organizations which have a say, because ultimately the patient is not the disease. It's patient as a whole who lives in the community, who has all the other problems which needs to be managed when we are faced with a health challenge. So a series of policy dialogues happened in the recent past with the World Health Organization through the Ministry of Health and University of Colombo, targeting these aspects, because continuous learning process through multiple stakeholder partnership is one such system reform which has to be carried forward. And what is the evidence from around the world? Some of it highlighted by the first speaker, but there are super aging nations in the West like Sweden, Finland, and Japan has the highest aging population, and also France and Australia. There are some system reforms they have adopted we can look at. And things like care integration, coordination across care continuum, which Prof. Sharul again highlighted the importance, and Finland and Sweden both have very strong primary healthcare services which are linked to this integrated care plan, and of course ensuring affordable healthcare across borders. And in Japan, the universal health coverage through insurance and pension schemes, they implemented it way ahead and they planned way ahead. That's why they're doing very good. And also employment possibilities for older adults, because countries like Australia, there's no set retirement age, because older adults contribute a lot to the economy. We are not appreciating that, and there need to be more opportunities to get their contributions. So this just highlights how Japan planned earlier on with all their policy reforms, because they had it was an aging nation, and they faced all these problems way earlier than us. So Australian experience, these authors have highlighted through case studies, and like Sir mentioned, we have to capitalize on newer technologies like digital health, and making sure our programs are under quality control, and there's continuous surveillance, and of course funding, which could be a big question, but again public-private partnership programs and some insurance schemes, programs or something like that we can come up to bridge gaps in healthcare provision. So what are the challenges? Just to summarize what we have been all discussing throughout this symposium, we need to ensure multidisciplinary teams in geriatric care. Some of our hospitals are privileged to have it, but because of all this skilled migration, we are seeing lack of team members in most of the hospital settings. And these MDTs, not only in hospital settings, but in community care, rehabilitation, and even at primary care, healthcare level, has to be ensured. So that is one of the challenges we have. And of course, ensuring the continuity of care. We provide it, but there's lack of communication and integration, which can be easily established, I would say, without a lot of capital investment. And improving rehabilitation services, I think Madam would know, I think all our rehabilitation services are probably geared for younger people because of this lack of resources, but geriatric population rehabilitation may not be necessary to hospitalize them and rehabilitate, but in the community. And of course, bridging out the out-of-pocket health expenditure is a huge challenge we have. How do we set about in navigating through these challenges? Of course, optimal use of available resources, because we have a wonderful healthcare system and our workforce is so strong, we have to optimally use them. And innovative practices in health service delivery, like Sir highlighted, all the care models that Sir discussed, and I highlighted briefly, can be benefited by innovative delivery models, which I'm sure our experts in these fields can come up with, and our students and researchers. And capacity building, I have already highlighted the importance and which needs to go on, and the public-private partnership. So the picture here shows a crowded hospital where probably the older adult is getting ignored because of the lack of time and overcrowding, but this needs to be changed, and it's happening in Sri Lanka, and we are so glad to witness it over the years, and I hope it will improve in the future as well. So these are my references, and thank you very much for your patient listening. I would be happy to take any questions at the end of the symposium. Thank you.